Welcome to the Daily Wellness Podcast. I'm your host, Melissa Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. This is a place where busy moms can learn about healthy living. I hope that what you learn here helps you feel empowered to take the next step in your family's health journey. Hello, Dr. Timmons. Thanks so much for joining me on the Daily Wellness Podcast.
Thanks so much for having me. I'm very excited to talk all things wellness. My favorite topic.
I know, me too. I could talk about this all the time. That's often why I tell people I have a podcast. I was like, I get to nerd out about wellness things for like an hour with people and ask all my questions. This is great. I have loved getting to know you a little bit. I see that you have been in like conventional primary care for over a decade and then kind of shifted to more of an integrative approach with functional medicine and longevity training and stuff. So I'd love to hear from you, just your perspective on that journey and transition and kind of how that came about.
Yeah. So like you said, I started out just in traditional medicine. I'm a board certified family physician. So I did primary care, worked at UCLA for over 10 years, just doing regular primary care visits. And a lot of those visits people are coming in for their annual physical and preventative visits. And a lot of people are coming in for chronic care management. So things like, high blood pressure, diabetes. And over time, I just felt like the constraints of that type of system, so of both the insurance constraints causing the appointment times to have to be so short, and the constraints of the type of medicine, which is more of a reactive, sort of put a Band-Aid on it type of medicine, partly because of the short visits. It's like all you have time for. I just felt more and more that I wasn't really upholding my Hippocratic oath, which is the oath we doctors take to, do no harm and to, I really didn't feel like I was doing, giving the most I could give to my patients and, because of these constraints. So I started to get more interested and started doing trainings on my own in functional medicine and longevity medicine. And I've always sort of followed a more natural lifestyle, and not my parents, had introduced me to more natural medicine and like homeopathic medicine and my, different things. So I was already exposed to that, but I sort of started to learn more and more on my own. And it just really resonated that I was like, okay, this, really looking for a root cause of symptoms versus just trying to put a Band-Aid on the symptoms, and really trying to take preventative medicine that we do in such a limited way at like those physicals to such a, a broader platform. And really that's, as I've learned more and more about sort of lifestyle medicine and realize that's like the basis of all of, what I'm doing with my patients now. And is, working on these lifestyle changes and habits. And those sort of changes take time to discuss with the patient. And it's not an easy fix of like, your blood sugar's high, take this medicine by, that's a 5-minute conversation versus looking at why is your blood sugar high? Is it because, what are you eating? Is it your diet? Is your stress? Cortisol can cause blood sugars to be high. Or you're not sleeping enough, lack of sleep causes high cortisol, which causes high blood sugar. So there's so many factors that need to be addressed that are things that just take more time. So I have fully transitioned and now have my own practice, and I'm able to do all those things and really treat people with this sort of more holistic approach. And I just really love it. I feel like it's been really gratifying for myself. And the most gratifying part is seeing patients feel better and get better and really feel like they're able to take control of their health and that their health is in their own hands, and to really optimize instead of just going through life feeling fine. They really feel, full of life and energy.
Yeah, I love the word optimized. I think that's really a key point of the difference between what you're doing now and what you could have done in primary care. And 3 things that stand out to me. First, we have a lot of moms listening, and you said that your parents kind of introduced you to some of these more natural ways of living and medicine and things like that. So moms, just take note of that what we are demonstrating and and teaching our children actually really matters.
So
And
true.
they are like noticing, even if you don't think so. And
And I
then
think to that point is that like as a kid, I was like, oh gosh, this is so, it's so embarrassing. There's,
right.
granola, they're so crunchy and they're, I thought I didn't embrace it. And now, as I became an adult, realized what a benefit that was to me.
Yeah, that's awesome. I love that. We could just quit right there. Like drop the mic.
Yeah.
But then I think like what you are doing now, like I live in a rural area, so I know some areas are different, but there is just such a need for practitioners doing what you are doing. We have a
Yeah.
epidemic of chronic
Yeah.
disease in our country, and people are just learning that there is a different way and
Yeah.
a way to actually heal your body and not just cover up symptoms.
Yeah.
And people are more curious about that. And so I just love that you are like stepping into that and really like
Yeah.
fulfilling the need that's there. And then third, I really just love what that says about your character as a person. It says that you are willing to learn and ask questions and be humble and like be having a provider that is curious is like one of my most favorite attributes in
Yeah.
a practitioner that I'm working with. So I just really admire that. So thanks for sharing your story.
Yeah.
um, I'm excited. One of the quotes that I read on your website is that you really desire to help people be the healthiest versions of themselves. It kind of goes back to what you said and like that
Yes.
optimizing, right?
Yes.
And in women's health, I think there are a lot of barriers to that. And so, just for the listeners to kind of know where we're going for today, I want to kind of talk through some of those barriers, such as kind of the messaging that we get from the media about
Yeah.
what health is and what we should look like and different things like that. Just the confusing world of hormones and
Yeah.
not understanding them and not knowing what to do about them. And so I want to kind of talk through that.
Mhm.
There's so much talk about peptides right
Yeah.
now, and I think that we really need some clarity as women on that. And then also, the last two things, if we have time, I want to also talk about what healthy movement looks like for a woman.
Yeah.
Because we all kind of just, I think, instinctively know that that's important, but we again get so many different messages
Mhm.
on, what that should look like. And then just mentally, like where do we need to be as women? What lies are we believing? Where could we get some clarity that would really propel us into like a healthier version of ourselves? So we'll see if we have time to get through all of that. But those are some of the things that are on my mind, knowing that you really specialize in just helping people be the healthiest versions of themselves. I'm like, well, we have a lot of barriers to that.
Yeah.
So let's just dive in. What do you think about kind of the messaging that we receive as women, as far as our body image and what we should look like? I feel like in social media, I have seen, being a health nerd, I have a lot of stuff in my algorithm that is, more health oriented. And there's a lot of people pushing back on the trending, like the trend that we're seeing now of like a lot of celebrities being just really, really thin.
Yeah.
Like I think we kind of like made some progress away
Yeah.
from for a while. And now it's like, oh my gosh. And I know
Yeah.
this will kind of connect to the peptides conversation as well. But I don't know. What are your thoughts on like healthy versus skinny and just kind
Yeah.
of a perception of ourselves?
Yeah, I think that's a really great question. And I think I agree with you that we've seen a shift. I think back a long time ago, it was, in the 1800s, it was like voluptuous was in. And then then we went through this period, the 60s and 70s, where super skinny, like the Twiggy was in. And then I think it kind of got back to just more of a normal body size. And then I think we are sort of body positive and embracing that there's all different sizes can be healthy. And then I agree with you. I think with the GLP-1s and, weight loss medications, we've seen, celebrities sort of showing an example of super, super skinny and people being like, oh, that's what I want. And I agree that it's a really great thing to talk about because skinny is not necessarily healthy. So you could be what we would think of as like skinny fat, or where you're skinny, but your body composition is, such that you don't have the balance of muscle and fat is off, and you don't have enough muscle mass. And I think what I like to tell my patients is that strong is the new skinny. So being strong is actually, I think we do see a lot of examples in social media too of that being the aesthetic goal. And I think a lot of women think, oh, if I lift weights, I'm going to look strong and in a way like a bodybuilder that's, not aesthetically pleasing, but actually strong is aesthetically pleasing. And the people that I think we often idolize that look toned and healthy and not overly skinny are actually very strong, and they get that way from lifting weights. And, I think so. I think it's being skinny is an ideal we should forget about, and I think we should think about being strong. And having muscle mass is going to be the thing that makes us feel the best. It's going to make us look the best. It's going to make us be able to age in a way that we want, where we can be independent and continue to do all the things that we currently love to do in our bodies now when we're 80 and 90 and beyond. Having enough muscle mass is the key to all of that. So I think that's, yeah, I think strong is the new skinny. That's what my message is.
What is the key between muscle and aging well?
Yeah. So we lose about 5 to 8% of our muscle mass per year after the age of 30. So we just naturally, are naturally losing muscle. So in order to even maintain, not build muscle, you have to actively do something to build your muscle, just to maintain. And having enough muscle mass has been linked with cognitive health. Interestingly, you don't think of like, well, dementia and muscle mass. It's linked to cognitive health, to metabolic health. So how well your metabolism works. We tend to think of our metabolism slowing down over as we age. That's actually not true. Our metabolism stays the same. It's just our lifestyle changes and our muscle mass decreases, and your muscles are a huge burner of metabolism. So the more muscle you have, the faster your metabolism, the more calories you need to just maintain. And it's also just hugely important for independence. So being able to be, if you get up off of the floor, get up out of a chair, to be able to continue to go on walks and hikes and lift up your grandkids. And we think of that as inevitable changes that happen with aging, and it's not inevitable. We don't have to age like that. That is due to a lack of muscle mass that just occurs if you don't actively work on maintaining it.
Hi, friends. I want to tell you about a new resource. Did you know that breast cancer is a problem? Of course you do, because 1 in 8 women will receive a breast cancer diagnosis. And we all know someone personally who's been affected by this. I started taking this pretty seriously a few years ago when I decided that I really wanted to come up with a breast health plan for myself. But when I went to look for information on how to do that, most of the information out there for women is about screenings and detection and not prevention. Knowing what I know about health, I knew that there had to be a way that I could really make my body resistant to disease and make my breast resistant to disease. After years of research, asking questions, learning, come to find out there actually is a lot that we can do as women to be proactive and pursue breast health 365 days a year. So I have decided to put this information into a guide because I really just don't see people talking about this. And I think women deserve to know the things that we can do that will really impact our health and reduce our risk of diagnosis. We talk about all kinds of things, and I get into over 30 pages worth of tips and practical things that you can be doing in your life that will really make a difference. And I really think that this can not just make a difference for you, but make a difference for the future generations of women in your family. If you want to learn more about this, it's called the 365 Breast Health Guide. You can get the link in the show notes, or you can go to dailywellnesscommunity.com. Yeah. And I think there's a little bit of a lack in our just long-term thinking of
Yeah.
okay, we obviously don't want to be the person in a wheelchair, the person that can't get off the floor, and play with my grandkids and whatever I want to do at that age of life. But connecting that with right now, I'm 44, and what I have to connect those dots of what I'm doing right now is
Yeah.
going to impact like my life 30 and 40 years from now.
Yeah. And I think to understand, yeah, that the way we age is not set in stone, is not an inevitable decline in our energy levels and our strength. And also the muscle mass has a huge impact on our bone health, and building muscle also builds bone. And one of the biggest predictors of sort of a poor a poor aging in the latter years is having thin bones, and one tiny little stumble and fall onto the floor and you break a hip. That's the number one cause of mortality in men and women, but women have a especially higher risk of this bone density issue because our bones are smaller to begin with. And as we go through menopause, that hormonal shift really thins out your bones. So doing everything we can to maintain strong bones, and that goes along with maintaining strong muscles, is so important for independence and feeling good.
Strong is the new skinny. I love
Yep,
that.
that's exactly.
Yes, I totally agree. So strength is one
Yeah.
indicator of kind of a woman being healthy, right? Like if
Yeah.
we're thinking about, optimizing our health and being the best version of ourselves, like that strength is one aspect of that. What are
Yeah.
some other like indicators that you look for of like, oh man, this woman
Yeah.
is really healthy?
Yeah, so strength and body composition is one key aspect. The other ones are things that you need to be kind of testing labs to be able to determine. So it's really important to get at least once a year blood work to check things like your blood glucose, and check your metabolic health. So we look at metabolic health by things like glucose levels, your fasting insulin levels, your HDL and LDL, the cholesterol levels that those are like the basics that any doctor is going to be willing to look at. And they're super important markers, as well as blood pressure. We kind of having a normal blood pressure. So those are markers that we look at because they indicate how well our body is working and all the systems are working. And those are like the basics. You can also go beyond that to get some labs that, sometimes the insurance doesn't pay for it. Sometimes you have to push for it with a regular doctor, but like an ApoB or apolipoprotein B is a really good marker of cardiovascular health. And another marker that of overall health and fitness is a VO2 max, which is the maximum amount of oxygen that your body can take in when you're exerting yourself maximally. And the reason this is so important is it tells it all in order to be able to take in, to have a high VO2 max, you need all of your systems to be working. So your heart has to be pumping hard enough to get the blood around your body. Your lungs have to be working well to when the blood gets to your lungs to exchange the oxygen and CO2. And then your muscles have to be strong and working well in order to use the oxygen that's then delivered to your muscles. So a VO2 max is a really good indicator of overall sort of cardiovascular muscle and lung fitness. And a VO2
Mhm.
max can be measured in like a lab wearing a mask, and that's a sort of complicated way to measure it. But a lot of the wearable devices like the Oura Ring and different, like I think the Garmin watch, they estimate a VO2 max using other metrics, which actually does correlate pretty well with the real measured in lab ones. So like I know I like on my Oura Ring, I've tested it out I've done the real lab, the lab in the exercise physiology lab, and it correlates very well with that. So that's something to kind of keep an eye on too.
Okay. And I mean, a lot of this testing you're not going to get with a conventional doctor. So you would probably have to
Yeah.
pursue like a more integrative or functional medicine doctor. Is
Yeah.
that right?
Yeah, and I think there's platforms out there that also have give people access to these advanced tests as well. So like Function Labs, this isn't like anything, no financial ties there, but they offer a panel that anyone can buy that's a more full blood panel and some more full blood testing that is a somewhat reasonable rate. The one thing I have to say with those is that you get all the results and then you have some abnormals and things to do, and they do give you a written sort of summary, but it's hard to then put that information into action. So it
Yeah.
is nice for access, but it's also great if you can find a provider to work with. That's going to obviously be more
Yeah.
helpful.
And what about determining your body composition? How do you do that?
So the gold standard is a DEXA scan, which is an X-ray that looks at your body and it can tell your percent muscle mass, your visceral fat, which is the fat around the organs that's very inflammatory and dangerous. It can tell your bone density and bone mass. So DEXA scan is something that is not, is available if you kind of know where to look and to ask. But there's also a home scale that uses bioimpedance, where it's a scale you step on. They have pads on your feet, and then you usually have to pull up and hold onto something. So you can get, like, Hume has one that you can buy at home. A lot of gyms have one in the gym, like InBody is a brand that I've seen in a lot of gyms that you could use it at the gym. And those, again, it's like the VO2 max and the Oura ring. It is a very good estimate of those same things. So a body composition, so percent muscle mass, it doesn't tell your bone density, but it is a very good way to be able to measure at home if you don't have access to the DEXA scan. But yeah, if you're working with a practitioner, getting a DEXA scan is the best way.
Yeah. I always like just information. I'm like, give me as much as you can. Like, I want to know as much about myself as I can know, because that's how we can learn and prevent and, really optimize, like you said. And one thing for people to know is that if you're going to a conventional doctor and you get your, like, yearly blood work done, it's going to be like a limited number of things that your insurance covers, right? Unless you're having some symptoms of something else that they can justify testing. But even that is good to have. It's better than nothing.
Yes.
But I will say that, like, what I have noticed is that, like, the interpretation of those results is very different with a conventional doctor than a functional medicine doctor. So they'll have, like, you'll get your results and they'll be like, okay, these are the normal ranges, and tell you if you're outside of that. But what I've noticed is that their normal ranges really are not optimal.
Yeah.
So, like, okay, well, this is normal for the US population that is mostly sick. Okay. Well, great. That's not what I'm going for. I'm actually going for optimal. And a functional medicine or integrative doctor like yourself is going to be able to really interpret those results from a more optimizing lens.
Yeah.
Wouldn't you say?
Yes, that's 100% correct. And I think if all you have access to is your regular primary doctor and you're just going to your physical, like you said, that's only a limited amount of data you're going to get. But you on your own could learn how to interpret that data and really get more out of it. So, like your example of what you just said, blood sugar is one of the, so many Americans have unhealthy blood sugar levels and insulin resistance, prediabetes, and diabetes. And, like, for example, a blood sugar, we say in traditional medicine, just less than 100 is normal, a fasting blood sugar. And so you could have a fasting blood sugar of 99 and they'd be like, okay, great, looks good, see you next year. But, that is not normal. Like, I mean, it's still within normal. It doesn't mean you have prediabetes yet, but it means that your body is not working well. You're not able to clear the glucose from your system. If you tested some other things, you'd probably see you do already have insulin resistance. So just knowing that is something you could say, okay, really under 70 is ideal. And there's things that you need to work on. So
yeah, exactly. So just keep that in mind. Depending on where you're getting your blood work done and your testing, you want to have it interpreted by someone that can really help you understand and learn what is more optimal for you, and not just quote unquote normal, because we're not going for the normal American health standard around here.
Like you mentioned, those lab values of what's normal are based on sort of what's average, not what's best. And for example, with testosterone, we know testosterone in men has been declining over the last 50 years tremendously. Just from 2000 to 2015, it declined 25% in 15 years. It's going down, down, down. And so now they've adjusted the lab value to be normal for this lower level. So now at the lower level, let's say a 20-year-old, their normal range is the same as like a 50-year-old used to be, back 50 years ago. So they adjust it based on the population, and we don't want to just be the, average for our sick population.
Right, exactly. So yeah, just keep that in mind because
Yeah.
they don't tell you that. They don't
Yeah.
give you a warning or anything.
Yeah.
So you
And
wouldn't know.
yeah.
Yeah. When my husband had his last blood testing done, he had to really advocate for himself to even have testosterone
Yeah.
tested.
Yeah.
They weren't going to test his testosterone, and he had to like specifically ask for that. And then when the last time I had mine done at a conventional doctor, there was like no hormone testing. So I had to go to a completely different, practitioner to do hormone testing.
Yeah.
Um, and that's another one of the barriers that I wanted to talk about because it's really, really unfortunate that we're not
Yeah.
giving women more information about their hormones because I think a lot of women are curious, like even, especially if they start to have a few symptoms, which the majority
Yeah.
of women do as they get to 40 and beyond, especially, like, oh, I wonder if how my thyroid is doing, or I wonder
Mhm.
if my estrogen is too high or too low, women suffering with PCOS and wanting to know where their hormones are at. And like, there's just so much I think that women are curious about, confused about.
Yeah.
And we're just not getting the information that we need. It's kind of overwhelming because there's a lot of hormones
Yeah.
and if you're still a cycling woman, your hormones are fluctuating throughout the month and you don't know where you should be. And so guess what advice would you give us about just trying to learn about our hormones? What information should we be seeking out as far as testing and how often and things like that?
Yeah. Sorry. I think that's a great question. And it's a little bit of a complicated answer. And that's
It
partly why
is.
in traditional medicine, a lot of times it's just like, well, it's not a perfect answer we're going to get from the test. So just don't even test. There's no point in testing. So I guess the answer is that I recommend that you should advocate and you'll have to push because a lot of times either the insurance won't cover it or your doctor will be like, no, you don't need that. But advocate getting hormones tested starting in your 30s, because that's going to give you a baseline. And I think what makes this complicated is, like you said, knowing when to test what hormones. So generally testing like estrogen is best to be testing on like day 3 or 4 of your cycle, assuming that the first day of your cycle is the day you start menstruating. And if you have an irregular cycle and you can't really do that, you can still get data from testing anytime in your cycle, but that's going to be ideal. And then the tricky part is testing progesterone is best on like day 21. So towards the end of your cycle. So there are ways to interpret the labs if if you test them both, at the let's say the beginning, you'll know the estrogen should be high and the progesterone should be low. But I would recommend sort of everyone really pushing for getting at least estrogen, progesterone, and testosterone, so free testosterone and total testosterone tested just in a regular blood test. And then also getting thyroid. So thyroid is a hormone as well. It's not one we sort of think of as our female hormone, but it's also very important. And getting at those tested so that you have a baseline. I would also ask with the thyroid, sometimes they just do the TSH, which is one thyroid test, but I would request a T4 and a T3, which are the actual thyroid hormones, and a thyroid peroxidase antibody test, or it's also called TPO. And that's a test to look for if you're starting to have any kind of what's called Hashimoto's, or low thyroid is extremely common in women. And sometimes before the TSH changes, you see that you start to have those thyroid antibodies, and then it's like a signal before you actually have to get sick to be able to tell. So getting
Yeah.
those, I think, as a baseline, and again, if you have to, have a list and ask your doctor is really important. And as far as the female hormones go, the thing to know is that um, the ranges for those hormones are likely going to be normal. So let's say you're 35 and you start feeling, more irritable or brain fog, or you're having a hard time sleeping or feeling hot. Those are all symptoms. Maybe you're starting to have perimenopause symptoms if let's say you're 39 or 40, and that's likely. But if you get those levels tested, they might there's a very high likelihood they'll be normal. So it's really important to listen to your symptoms and to realize that perimenopause and menopause symptoms are diagnosed mostly based on your symptoms you're having, as well as the hormone levels. So the hormone levels do help us understand, but it's also very likely that you're still like in perimenopause, especially, you're going to still be within the normal range, but it's because your hormones are fluctuating up and down and they've gone down over time that you're going to have the symptoms. Also, sorry, I forgot to say FSH is another really important hormone to test when you're getting the basic blood work hormone tested. So it's important to understand that you may, if you go to your doctor and I'm having all these symptoms and then they do a blood test and they're like, oh, everything's normal. Don't just give up at that. There's still ways to optimize what could be perimenopause symptoms. And you want to, so it's sort of a diagnosis of exclusion. We want to exclude other causes that could be causing these same symptoms. And then, if you're at the right age and you're having the symptoms, even if your hormones are normal on the blood test, it still could be perimenopause.
Yeah. That's really good to know. And I definitely think that it would be incredibly, it would just be like a whole new world if women could like just annually get all of those things tested, see that, like you said, the changes over time. I know when I do things consistently like that, whether it's, breast imaging or blood work or whatever, when you can like really line those things up over time and see how your body is changing, it really does help you understand your body more and make more educated decisions about your lifestyle and things like that.
Yeah, I agree. Yeah. And there are more advanced hormone tests too that can be very helpful. Like a urine test. There's a brand called Dutch that does a urine test that gives like very extensive information about how you're metabolizing hormones and how the enzymes that break down the hormones are working and how the different metabolites, how high those are and the different levels. So that can be another helpful tool. Again, it's not one that's usually covered by insurance or readily available, but with like a functional or integrative medicine doctor, that's something else to consider kind of looking at.
So how do you determine with your patients, like which testing is going to be most beneficial for them, whether it's blood or urine or, a full panel or a mild panel or?
Yeah. So I suggest doing, and I do with my patients, the blood panel kind of on everyone to get a baseline. And then if we're trying to, if they're having a lot of symptoms that are not, if they're having a lot of symptoms, then doing that, a Dutch test can help us kind of get more information as far as how to treat those symptoms. However, if for whatever reason, the Dutch test, I don't feel like it's an absolute necessity to be able to treat. So if you don't have access to that or, you can still start treatment and optimize your hormones based on your symptoms and the blood tests that you get in the regular blood draw.
Yeah. I appreciate you talking about advocating for yourself and paying attention to your symptoms, because I think a lot of women do go get some testing. Everything turns out quote unquote normal. And then they have nowhere else to go, like no other step forward. Well, I still feel like crap, but but most conventional doctors don't have any other like directives for you.
Yeah.
And so like, how is that different with you? Like at that point, what would you be doing? What conversations would you be having with your clients at that point?
Yeah. So I definitely like to educate people that, like I said, that the blood tests can, be normal, but the perimenopause is diagnosed based on your symptoms and your sort of age and and some of the clues in the blood work, but it doesn't necessarily, it's not one blood test to do. So I would definitely recommend considering using hormones at even an early perimenopause stage. We used to say you kind of want to wait till you're sort of in menopause for at least 1 year. That was like the conventional way of starting hormones. Like after your period is stopped for at least 1 year, then you could start hormones. But we have more and more data that's showing us that starting earlier is actually better for symptom management and also chronic disease prevention. So for bone health, for cognitive health, for cardiovascular prevention, that there's the earlier you start is actually better. And then it also is very helpful for symptom management.
Mm.
So that's one thing. The other thing that I like to tell all patients, and especially women in early perimenopause, is that the foundational things that you do in your lifestyle are going to make a really big impact on your sort of hormonal symptoms. So getting enough sleep, eating a whole foods diet, moving your body every day, managing your stress, sort of taking care of yourself in those ways that seem like, oh yeah, I know I need to do that. But those are the things that are really going to help your hormones. And our bodies become more sort of brittle and less able to tolerate those stresses as we start to go through perimenopause. So it becomes especially important to take care of ourselves. And I think a lot of women are so used to taking care of their families and their kids. And are like, I don't have time to take care of myself. But it becomes especially important to, like I said, prioritize sleep, not just the number of hours, but the quality of sleep. And that alone, if we start with that, a lot of patients feel that, oh, okay, I actually, my hormonal symptoms that are due to your hormones fluctuating start to feel better. And maybe you don't need hormones yet, but
Yeah.
that
Okay.
at all stages is super helpful.
Yeah. That was, so when you say starting hormones, you're talking about like a hormone replacement
Yeah.
therapy. Okay.
Yeah.
Yeah. And then my second question was exactly what you just said. Like, so would you recommend kind of making some lifestyle changes and seeing if your body adapts well with that first before starting hormone replacement therapy?
Yeah, I would say that's kind of on a case by case basis. It depends on how severe your symptoms are. If you're really suffering and you're just, in the terrible place, then, if a patient comes to me and is just like feeling like crap and, then I'll do then I think it's, you could make a case to kind of do things concurrently. Like, okay, you're really suffering. Let's do everything we can right now. But I think if you're just starting to notice symptoms and you're like, what's going on? I would say dialing in that, getting that base of your foundation of your sort of health pyramid really strong is going to be very helpful. And I do like to encourage people to try to do that first because it's so important. And the hormones are not going to work as well, even if you're not doing those other things too.
Yeah. Okay. That's awesome. And is one of those things healthy movement?
Yes,
Like,
for sure.
okay. Yeah.
So
And that was kind of one of the other barriers I was thinking about, but it came to mind when you're talking about, these lifestyle changes, as I personally noticed a huge difference, when I move consistently, whether that's just walking or going to the gym, my mental health is so much better. And I think it's because, it reduces the cortisol for me
yeah,
and just really helps me to feel better all around, especially just mentally. And that stress response is so much better. I can just
yeah,
feel it in my body almost.
yeah,
But that is one of the areas that I think like is hard for women. Like some women didn't grow up with that, they didn't
yeah,
grow up playing sports or seeing parents that, moved consistently. And it's just
yeah.
like hard to get started when it feels so new and like outside of their comfort zone.
Yeah.
So what advice would you have to women when it comes to movement? I guess first, what is kind of your recommendation for
Yeah.
women in the area?
Well, I think one thing, like you said, that it's hearing your sort of testimonial of how much it helps you is one thing I think is to convince my patients that it's going to work. Like, trust me, I promise you, I've seen this work. This is going to help. And
I mean, talk about scientific data. There's so much
yes,
scientific data on this. Yeah.
yeah. So it's not just trust me. It's like, listen to all these testimonials, look at all the data, listen to
Yeah.
my personal experience with my patients. It's going to help. It's going to help everybody feel better, moving, being consistently active. And it's hard. I think sometimes people think like, oh, no, it's not really going to help. It's no point in doing that, but it is going to help. And I think the sort of, as far as the question of what should we be doing, I think that is a good question because it's changed. What the recommendation has changed. Like back before, it was always like women should be, do a lot of cardio and that will help you maintain your body weight. And cardio exercise is still important to help our, heart stay strong. But we've really shifted our focus to really trying to hammer home to patients and to women, especially how important, lifting weight training is. So resistance training. And so the sort of gold standard, if if you could, if you had all the time in the world and all the motivation in the world, it would be to, to at least to kind of hit the minimums of 3 days a week of some strength training and trying to do a full body, if you're doing 3 days a week, do a full body kind of strength program. Um, so 3 days a week of that, at least 150 minutes a week of something where you're getting your heart rate up. But this is where I think before women thought it had to be, your heart rate so high. It doesn't have to be. It's the sweet spot is what we call zone 2, which is where you're, just, you could still carry on a conversation. You're just a little bit out of breath. For most women, that's maybe a heart rate of like 110. So this is the equivalent of like a brisk walk. So not a meandering walk, but like where you're walking briskly, so it doesn't have to be, sprinting, to get a benefit. So getting at 150 minutes of that kind of zone 2 exercise. And then the sprinting and the high heart rates, the super intense heart rate is also very important, but it doesn't have to be hours and hours of it. So getting at least 15 minutes per week of high intensity exercise is important. So the way I like to kind of break this up, because people are like, oh my God, that sounds like so much, is basically think about moving your body every day. Do something where you're going to move your body every day. It could be a 45-minute brisk walk with your friend in the sun in a beautiful place, so it can be enjoyable, but move your body every day. And then with the 3 days a week of resistance training, try to do full body compound movements. It's more efficient that way. So that way you're moving using all of the different muscle groups, and then do 5 minutes of that high intensity cardio during those 3 sessions. So 5 minutes, 3 times a week, that's your 15 minutes. So just in the middle or at the end, do some sprint intervals of either on a treadmill or running up a hill or jumping rope or doing burpees or anything that gets you breathless. So where you're like breathing really hard, that's going to be your indicator that you're at your zone 4 or 5 cardio. And again, it doesn't have to be continuously for 5 minutes. It could be a minute on and 2 minutes of rest and then a minute on, but get your heart rate going. So doing that with your 3 days a week of weight training, and then doing some sort of walk or brisk walk, or other, tennis, swimming, any other running, any other activities that you're moving your body. So move your body every day.
Yeah. Yeah. And this is just like there's such a multi-layered benefit to this. Like,
Yes.
What you talked about at the beginning with strong is the new skinny, those longevity benefits of muscle and strength, and the hormone benefits, the mental health benefits, the cardiovascular benefits. I mean, there's just like so much. And honestly, just the joy factor in your life, you said being in a beautiful place or working out with friends. I mean, I think it would really help women to overcome this barrier if they also maybe had realistic expectations. Like, so maybe this will be a little bit awkward or uncomfortable at the beginning, or maybe it will take some time to find the thing that you enjoy, and you can be consistent at, or, maybe you're not going to like look completely different or lose 50 pounds in a month, So I think like having like realistic expectation also could help people.
I think that's for sure true. And having the mindset of that you don't have to be perfect. It doesn't have to. So I just gave you like the perfect split of, if you could do everything. Do I do that every single week? No, that's my goal, but it's not always perfect, and consistency matters so much more than perfection and so much more than intensity. Just so doing something consistently is the key. And my other big point to get over the mental barrier is just start. You don't have to have a perfect plan. It doesn't have to be, it doesn't have to be perfect. Just get started. And I often give my patients, the goal of, okay, 150 minutes of moving is the goal. Start with 15 minutes a week or 5 minutes at a time. Like if you set aside 5 minutes and go on a little 5-minute or 10-minute walk after, let's say after a meal, and you start doing that consistently, A, it's going to make a difference for your health, and B, it's going to get you into the mindset of that you're taking care of yourself. I'm setting aside time to do something for myself. And you're going to find that, you can like start with 5 minutes, then maybe the next week, okay, I could do 10 minutes. And then you get that, consistently.
Yes.
And it takes 3 weeks to really build a habit. So it's hard during those first 3 weeks. You have to like, you're not going to want to do it. You're going to have to push yourself. You're going to have to set an alarm. You're going to have to work. And once, after about 3 weeks, it becomes a habit and you're like, oh, it's 9 o'clock. This is when I always go on my walk. And you go and it becomes easier, but it's hard at the beginning. And you can just start with something that's manageable. Start with a small bit that's manageable and build from there. And you'll eventually get to the goal if you stick with it.
Yeah, I like that. That's such good advice. We're kind of on the topic of mental shifts right now.
Yeah.
I think that this really like applies to that topic, what we're talking about, like having right expectations and kind of having the right mindset of like
Yeah.
what it should and could look like in your life. So what else would you say like are some kind of mental shifts that we need to make as women to really be women that are pursuing the healthiest versions of ourselves?
Well, I think one important shift is to understand that it's important to take care of ourselves, that it's not selfish. It's not, that it's actually, that it's not taking away from the other people that we are, trying to care for. It's going to add to those, it's going to add to those ability to take care of
Yeah.
other people if we take care of ourselves first. And I think a lot of women feel like, it's like, I don't have time to take care of myself. I'm taking care of all these other people, but you're going to do a better job taking care of everyone else if you take care of yourself.
Yeah.
So yeah, that shift I think is a really important mindset shift.
Yeah. Yeah, I agree. I actually read a book that talked about some data around that topic of how we kind of sideline ourselves as women. Like
Yeah.
we take care of everyone else and really put off doing the things that would, increase our quality of life or
Yeah.
help us be more proactive in our health, or maybe just get help with real issues that we have going on right now.
Yeah.
We ignore it, tell ourselves that it's not that bad, or
Mhm.
maybe we had a doctor tell us, that everything was normal. So we just tried to push through or,
Power through. Yeah.
ignore the symptoms. And so it's really, really easy to do that. Even, I don't know everything, obviously, but even knowing what I know about health, like I still do it sometimes. Like I still
Yeah.
put things off that I really need to get done. Like this hormone testing, as we were talking
Yeah.
about this, was like, oh, I'm really overdue for this.
Yeah. Yeah. So I think take care of yourself and it's going to, help your kids, like you mentioned at the beginning, seeing a mom who's active all the time and who's prioritizing, getting moving her body, that's going to help them for the rest of their life to do that and, do things, figure out, be creative as far as like, okay, maybe you bring your kids with you, they can do like it's their own little weights while you're doing your weights or, just
Definitely.
like it doesn't have to be like 1 hour in the gym to count. It can be, something you can be creative with it, but taking care of yourself and prioritizing yourself is
Yeah. I think one other like important thing for me has been just to learn to really filter the messaging that you're getting on social media or TV or even in a friend group, like I don't know, just be really mindful of like, is this messaging really healthy? Like in a in all the ways, like
yeah,
holistically healthy. Is this really like a good thing for me personally? Is this really true? And just to really, maybe you listen to a podcast and you hear something that really worked for one person. Well, you really need to filter that, like, is
yeah,
that a good fit for me? And, as we talked about in the beginning, like I see all these celebs getting really skinny. Oh, maybe that's what I need to do. We
yeah,
can like really easily transfer
yeah,
messages to ourselves and make
yeah.
those our goals without really stopping to think like, is this really what's good for me?
Yeah. I think that's what brings up a point that I make to my patients all the time is to trust your intuition, listen to your body. Like, your body better than anyone else. And for someone to be able, like, for me to be able to help you, I got to, hear what's going on. So you have to learn take note and listen to your body and learn the signals. And like I say, listen to it when it whispers so it doesn't have to scream,
Yeah.
learn to really pay attention to those signals. And I think that is this kind of carries over to what you were saying about when you get advice, if you think, oh, is this something I should try? Does it feel right? Does it resonate? Does your intuition tell you that seems right? And maybe yes. So then you try it. Well, is it working for you? It's not the same thing's not going to work for everyone. So that's okay to be like, okay, that works well for, it seems like everybody, but that's not going to be what works well for me, and try something else out. But so to trust yourself too, to trust your intuition, trust that what your body needs, if you can get in tune with that and listen to it.
Yeah, I love that. Thanks for sharing so much wisdom and bringing so much clarity. If people are interested in working with you more, do you do virtual consultations or only in person?
No, I do virtual consultations. I sort of, I don't do one-off consultations. I have sort of a membership program, because I feel like making change really takes it takes a longer time. So working together sort of over the long term, but I do see people virtually. So people can sort of learn more on my website. I have like a blog postings that I put on there, and products I love, and a lot of information on my website, which is timmonswellnessmd.com. And then I love to give this sort of same health information through social media. I love to share information that way. And Jennifer Timmons, MD. I share my information on TikTok and on Instagram. And
yeah. Okay. We'll make sure we link all of that in the show notes for everybody. Thanks again. We didn't get to peptides.
I know everybody's wondering.
Have another conversation about that. It's just such a big topic. Yeah. So maybe we can meet again about that. But this was awesome.
I would like to. I was thinking, shoot, everyone's gonna want to know about that one. But
yeah.
Next time.
Well, thanks so much for your time. Appreciate you.
You're welcome. Have a great day.
Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.